Hi everybody, Dr. Mike here. In this video, we're taking a look at an overview of respiratory physiology. Now we need to keep in mind that the fact that the whole purpose, or the primary purpose of our respiratory system is to bring oxygen in from the external atmosphere, take that oxygen into our lungs, transfer it from our lungs into our bloodstream, and allow for the bloodstream to transfer that oxygen to the tissues of the body. Then at the tissues of the body, we take the byproduct of creating ATP or energy, the exhaust of our cells, which is going to be carbon dioxide, take that from the cells into the blood, take it now in reverse from the blood to our lungs, throw it into our lungs, and then we exhale the carbon dioxide. So it's a two-purpose system, bringing in oxygen and removing carbon dioxide. And the way that this works is because the respiratory system focuses on playing around with pressures. So we need to take a look at pressures, and there's actually 3 gas laws that we need to have a look at today that explain exactly how the respiratory system works from start to finish. The first thing we need to look at is the atmosphere itself. The fact that I'm standing here at approximately sea level, so I live in Queensland, Australia, and we are very close to sea level, what we're going to find is that if I take a look, so I'm at sea level right here, and I'm standing here, a very skinny, stick figure looking person with a smile on my face. If I stand here and notice that if I were to draw a tube around me that goes all the way up into the sky and capture the various gas particles within that tube, what I'm going to find is that those gas particles will be exerting a particular amount of pressure onto me. Now we've spoken about pressure before in our cardiovascular system lectures, and we've spoken about blood pressure. So blood pressure is the force that the blood places on the walls of the vessels. Gas pressure is the force that the gases place on the walls of a container, for example. Now, I've said to you that the blood pressure is 120 millimeters of mercury. At least when the heart contracts, it's 120 millimeters of mercury. That's enough pressure to squirt blood about 1.5 meters, right? Now here's the thing, that's 120 millimeters of mercury. The pressure that right now at sea level that gases are placing upon me is actually 760 millimeters of mercury. That's far greater, that's almost 7 times greater than the blood pressure. Now the question you might ask is, I don't feel that pressure, right? Why not? Well, it's because simply we were born into this, right? We were born into this atmosphere and we feel it. The only times that we feel it is when it's different. So for example, if I decided to then climb Mount Everest, and I'm now standing on top of a mountain up here, and if I were to just remove this 760 for a second, now I put a tube around me going up to the same height and think about all the gas particles inside, there's going to be fewer gas molecules inside of that tube. Now remember, all pressure is the force that these gas molecules place on the walls of a tube, for example. Because there's fewer gas molecules, the pressure is going to be lower. So here at sea level, it might be 760 millimeters of mercury worth of pressure, but here, it might be significantly lower. It might be something like, let's say, 600 millimeters of mercury. Now, the reason why this is important is this. The gas molecules that are surrounding me right now is a mixture of different gases. And now we're going to start talking about something called Daltons Law. Daltons Law basically states that in a mixture of gases, the total pressure, so in this case, 760 millimeters of mercury, is equal to the sum of all the individual pressures. So for example, in this case, we are surrounded by 3 major types of gases. So the first gas that we need to talk about that we are surrounded by is that of nitrogen. Then there's oxygen. Then there's carbon dioxide. And then the rest is what we call trace gases. So nitrogen, for example, 78% of our atmosphere is nitrogen. 78% of all the gases around us is nitrogen, but we never talk about our body using nitrogen. I can talk about that shortly. Oxygen is 21% of the entire atmosphere, and carbon dioxide is 0.03%. Now, the remaining are what we call trace gases, like argon, for example. We don't need to talk about those. These are the three main gases in the atmosphere. Now, the thing with Dalton's Law is that it states that this 760 millimeters mercury of pressure of the gas around us is simply each of these gases added up. So you can do a simple, you can take your calculator out, take your phone out and go, okay, what's 78% of 760? And you'll find it's going to be something around 593 millimeters of mercury. So in the atmosphere at sea level, you have 593 millimeters of mercury worth of nitrogen pressure being placed upon you. Oxygen being 21%, this is going to be around about 160 millimeters of mercury worth of pressure. And if you have a look at the carbon dioxide, you're going to find this is going to be around about 0.3 millimeters of mercury worth of pressure. If you add them up, it's going to be 760-ish millimeters of mercury worth of pressure. This is Dalton's Law, that the total mixture of gases is simply the added up of each partial pressure of the gases. So what we term this is the partial pressure. The partial pressure. This is a really important concept for you to get your head around, first of all, is the partial pressure, because we're going to state very soon another law which talks about the fact that each gas only moves down its own pressure gradient. Down its own pressure gradient. We've spoken about diffusion before, which is the concentration of things like solutes, right? And those solutes will only move down their own concentration gradient. So for example, if we've got a cell, for example, right? If I've got a cell and I've got a lot of sodium outside the cell and I've got a lot of potassium inside the cell, the sodium will move down its own concentration gradient and go inside. And the potassium will move down its own concentration gradient and go outside. Gases are exactly the same. They will only move down their own pressure gradient. And a take-home point that you must understand is gases will only ever move down their own pressure gradient. Gases will always move from a high pressure to a low pressure. That's why when you watch the weather, it says a high pressure system is moving in. It's always going from high to low. Think about going down a slide. We'll go back to this concept shortly. So now we've got this Dalton's Law. We understand it. This is what's out in the atmosphere. Next is I want to have a look at the lungs itself and how we take these individual gases and bring them in. Firstly, I want to take these two because they're the major gases we are dealing with, oxygen and carbon dioxide. So let's draw them up here. We'll have oxygen here and we'll have carbon dioxide here. And we know that the partial pressure of oxygen in the atmosphere at sea level is 160 millimeters of mercury, and carbon dioxide is around about 0.3 millimeters of mercury. How do we bring the gas that's outside into our lungs? I know that seems weird, but how do we do it? No one's pushing it in. Our lungs aren't a vacuum cleaner. There's no engine or motor that's whirling to be able to bring it in. So how does it work? This is where we need to talk about the second gas law, which is called Boyles Law. Now, Boyles Law states, Boyles Law is a really interesting law, super important to understand. Boyles Law states that there is an inverse or opposing relationship between the volume of a container and the pressure inside of that container. What does that mean? Let's think about this. I've got a small container here and I've got a larger container here. Now let's just say I had 5 oxygen gas molecules present in that small container, and I have the same number present in this one. 1, 2, 3, 4, 5. So both have 5 oxygen molecules present within each. Now remember, molecules are constantly moving and shaking, and they move through something called Brownian motion, which is this random motion in which they basically just bounce off things and continue to move along. This is what the gases are doing. So these oxygen molecules will be bouncing off the walls as they move around. The pressure that these gas molecules exert inside the box is directly relevant to how often will they bounce off the walls, right? So here in a smaller box, these 5 gas molecules are constantly bouncing off the walls. So the pressure is going to be quite high. So even though the volume of this box is quite low, the pressure is going to be higher, right? In this larger box, with the same number of gas molecules, they're less likely to bounce off the wall because it's further away, right? And because there's so few gas molecules, it's rarely going to happen. And so the pressure in this one, even though the volume is higher, the pressure is lower. So you can see that there's an inverse relationship between the volume of a container and the pressure in that container. Another great way, another great example that demonstrates this is using a syringe, right? So we can take a syringe here. So let's just take a syringe. There we go. There's our syringe. There's the plunger. And let's just say we've plunged it about halfway right now. And we're going to have, let's just say 1, 2, 3, 4, 5 gas molecules inside of that syringe. What happens when if I were to pull down on that syringe and increase the volume inside, right? Well, you know that when we pull on the barrel of the syringe, things get drawn in. Gases, fluids get drawn in. Why? Because we change the pressure, because we change the volume. So if I were to pull back on that and increase the volume, what we're going to find is that the pressure is going to change. So now it's been drawn all the way back to there. Now, even though 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, the volume is greater, but the pressure has gone down, right? Just like those boxes we drew. Now remember, if the pressure is lower from here to here, from inside to outside, gases want to move down their pressure gradient. So if the pressure out here is higher now than it is in there, what do you think it wants to do? It wants to balance it out, so gas molecules will move in until it's balanced out. This is how our respiratory system works. We need to change the volume of our, what we call our thoracic cavity, and when we do that, we change the pressure, and when we change the pressure, if the pressure is lower inside than it is outside, things will move down its pressure gradient. If we decrease the volume, things will want to move out because now it's a higher pressure inside than outside and things move out. That is Boyles Law, the inverse relationship between the volume of a container and the pressure inside that container. Once you understand that and you know that all gases will move down their pressure gradient, well, that's important because you will then know which direction they're traveling. Perfect. All right. So let's now take this. How do we get these gases from here to here? I've just told you we need to apply Boyles Law. We need to increase the volume of this thoracic cavity. How do we do this? Well, first thing is that at the very bottom of where our lungs are, we've got this muscle. And this muscle is called the diaphragm, right? Now, you know what I want to draw before I draw that diaphragm? I want to draw up a really important structure called the pleural cavity. Let's draw that up because that's super important to understand before we even go into the diaphragm and everything like that. So let's take a look at drawing up the pleural cavity. So what I've drawn up, as you can see, is that there is now a cavity, a 2-membrane cavity here that surrounds the lungs. Again, this is called the pleural cavity. And it's got 2 membranes, right? One membrane is most adherent to the lungs. That's called the visceral pleura. That's this one here. And then the one that's attached to the thoracic wall, the wall of our thoracic cavity, that's called the parietal pleura. So it's going to be attached to our thoracic cavity. And we know that we have our ribs now here. So let's draw those ribs back up. 1, 2, and we're just going to draw an arbitrary amount of ribs. We don't need to draw the exact amount of ribs. Let's draw it up over here as well. All right, there's our ribs. Now, let's draw that diaphragm up under here. Perfect. Now, outside, I said the pressure overall, cumulatively, including all the gases, is 760 millimeters of mercury. At rest, inside of our lungs, it's also 760 millimeters of mercury. It's the same. So where's the gas going to go in this scenario? Nowhere. The amount of gas going in is going to equal the amount of gas going out. There's basically no net movement at rest. Now here's the thing. If I were to now measure the pressure inside this pleural cavity, right, it's going to be around about -4 to 5 millimeters of mercury more than those inside and outside, right? This means it's going to be 756 millimeters of mercury. Ooh, think about that now. What does this mean? Higher pressure here, lower pressure here. It's like a sandwich where 2 slices of bread are a higher pressure and the meat in the middle is a lower pressure. That's the pleural cavity. That's the lower pressure. What does that mean? I said high pressures want to move to low pressures. So that means that the lung tissue itself wants to stick to the pleural cavity. Drew that in the wrong direction. Wants to stick to the pleural cavity, and the external atmosphere places pressure on the pleural cavity as well. So that means this pleural cavity is stuck together like that. Luckily, they release a fluid in between so that it's lubricated, but the lungs want to stick to it, and the external atmosphere is pushing down onto it as well. The reason why this is important is because the lungs are adherent to the pleural cavity, which means wherever the pleural cavity goes, the lungs will follow because it's stuck to it because of, again, the pressure difference. The high pressure wants to go towards that low pressure. So again, how do we bring these gases into the lungs? We need to apply Boyles Law, increase the volume of this thoracic cavity. There is a couple of ways we can do it. The first primary way we do it is we take this dome-shaped diaphragm muscle and we contract it. When we contract the diaphragm, we bring it from a dome-shaped shape to a flattened shape. And because the diaphragm is pulling down on the pleural cavity, and I said the lungs are stuck to the pleural cavity, the lungs come with it. What we've just done is we've now increased the volume of the thoracic cavity. Because now we've increased the volume here, what do you think happens to that pressure? It goes down. It goes from 760 lower. And that then allows for this gas to go, oh, there's now a pressure gradient. I want to balance that out. And this gas will rush in. Now that's if we want to take a small breath in. What if we want to take a really deep breath in? Well, we need to now recruit what we call accessory muscles, additional muscles, to help further increase the volume of our thoracic cavity. This is where the rib cage comes into play. And we've got 2 muscles that join our ribs together. We've got the external intercostals. These are the ones on the outside. And we've got the internal intercostals, the ones on the inside. Right? Now they're on both sides. But just so I don't make it messy, I won't draw up the whole thing. But you've got the external on the outside and internal on the inside. Here, we're contracting the external intercostal muscles, and what they do is they bring the rib cage up and out. That's what these external intercostal muscles do. Look at that. The diaphragm pulls it down, making the thoracic cavity larger. The external intercostals pull it up and out, and we've further increased the volume, which means now this pressure inside here, it's going to be dropping precipitously, which means now even more gases come in. Perfect, right? So that means we're now bringing that oxygen and carbon dioxide into our lungs, in through the airways into our lungs. All right, let's take a look at this now. As this gas comes in, what you're going to find, interestingly, so we're now going to pretend that we are now into the alveoli, right? This is this site of gas exchange. If we are now in the alveoli, what we need to understand is that the alveoli are going to be in close proximity to that of the bloodstream, of the capillary network of the respiratory system. So once the oxygen is in, so let's draw oxygen up here. Let's draw carbon dioxide here. Here's the interesting thing. Once it goes from outside in the environment into the alveoli here, the oxygen goes from 160 to 104. And the carbon dioxide goes from 0.3 to 40. This is interesting. How does this happen? How do we lose oxygen by getting into the alveoli? How do we gain carbon dioxide? Well, remember that you've got a blood stream here, which basically is circulating around the entire body. And I'm just going to draw it like that to make it easier. So that's the entire circulation going to the body. Remember this, as the oxygen comes in, the airways, the respiratory tract, it has three major roles, right? Regardless of the temperature of this air and the humidity of the air, by the time it gets here, it will be 37 degrees Celsius. It will be 100% humidified, and hopefully it's cleaned, right? That's its process as it travels through the respiratory tract. It's the humidification. This is where we add water molecules to the gas molecules. And sometimes what can happen is the oxygen that travels in gets actually pulled into the water molecules. So we lose oxygen by throwing it into some of the water molecules that are present throughout the respiratory tract. So that's how we drop down that a little bit. But the other thing is, remember, here at the alveoli, oxygen, what it wants to do is jump into the bloodstream. So we're losing oxygen straight away because it wants to jump into the bloodstream. That's why it's 104 millimeters of mercury here. Now, carbon dioxide goes from 0.3 millimeters of mercury to 40. It goes up. Why? Well, the major reason is because we know the bloodstream here is throwing carbon dioxide out. That's why it goes up. All right, here's another point. This is now where we apply the third law called Henry's Law. Henry's Law basically is referring to the fact that each gas will move down its own pressure gradient, right, through a fluid. And so if you've got a bit of fluid or liquid, the thing that determines, the thing most important that determines whether a gas dissolves and diffuses through that liquid is its partial pressure gradient from one side to the other. So what we need to imagine is that here we have water. And we do. We've got water in our alveoli. Your alveoli is actually covered with water, right? And this is important because water is really sticky. And people don't necessarily realize this, and it's a little bit of an aside, but remember, water is made up of H2, 2 hydrogen, and 1 oxygen in a boomerang-shaped fashion. The hydrogen is slightly positive charged and the oxygen is slightly negative charged. This makes water a polar molecule. Polar means it's charged, right? The great thing about this is water likes to be attracted to other charged things like sodium and potassium and chloride and magnesium, and they're all got charges. The positive is associated with the negative becomes associated with the positive. They like shifting each other around the body. That's super important. But the other thing you need to recognize here is that the hydrogen, the positive hydrogen, will love other oxygen molecules which are negatively charged, which means water attracts water. That's what makes water sticky to itself. Now, on the macro level, we think about water more so as something that's slippery, as a lubricant. But on the micro scale, water is very sticky and adhesive. And the reason why this is important is because if you think about inside of our alveoli, they're like little bunches of grapes, right? If they got water lining their surface, which they do, right? This helps facilitate gas exchange into the bloodstream that's moving past. That's good. But you take a breath in, they expand. Great. You take a breath out, they shrink. Now, if they shrink so much that the water on this side comes into contact with the water on this side, what do you think the alveoli does? It collapses. And if you've ever had something like a glass chopping board or a glass flat thing and you put water on it and put it flat on your stone bench top, it's nearly impossible to pull off. You have to slide it off, right? You will not be strong enough to pull it off. Same thing here. If those alveoli collapse because of the water sticking together, you do not have enough muscles in your body to be able to physically open those alveoli back up. So what do? Well, luckily, our body has these type 2 pneumocytes or type 2 alveoli cells that are present inside of our alveoli, and they secrete something called surfactant. And what the surfactant does is it breaks the surface tension of the water. So if you break the surface tension of the water, it's less sticky, right? Remember, if you have a glass, right? Get a glass, fill it up with water from the tap, and you'll find that the water tends to form a meniscus layer. So it goes above the lip, yet it doesn't tip over the edge. Why? Because all the water molecules are sticking to themselves, right? Like that, sticking into the middle. But if you were to pour detergent on it, or an oil or something like that, it tends to break the surface tension and it falls down. And that's what the surfactant does. That's released by the alveoli. It breaks that surface tension. So that's a little bit of an aside, but it's very important because babies born prior to 6 months of age can't make surfactant, and they need artificial surfactant delivered to them. Otherwise, they cannot breathe. They take their first breath in, that's great. They take their first breath out, airways collapse. So we need to give them surfactant. All right, remember we're now applying Henry's law about the fact that in order for oxygen to go in that direction, what does the pressure, the partial pressure, remember that's the term we use, what does the partial pressure of oxygen, we can write PP if you like, what does the partial pressure of oxygen need to be here in the bloodstream? That's, remember the blood's moving in this direction, right? And down here we go into the tissues. So they're individual cells, the tissues of the body, right? What does the partial pressure need to be in this bloodstream going past? Well, the oxygen partial pressure needs to be lower, right? Needs to be lower because it has to be like a slide. Things will go from the top of the slide down to the bottom of the slide because it's going from high to low, it costs no energy. Same with pressure. So we need to think about what the partial pressure here is. Interesting. It's going to be at around about the partial pressure of oxygen, 40 millimeters of mercury. I won't draw in that because it's going to take up too much room, but it's 40. So we're going from up here, 104 millimeters of mercury. This is for oxygen going down the slide, all the way down to 40. Whee! Down the slide. Great. Okay, carbon dioxide. In order to go from in the blood out, it needs to go down its pressure gradient. So the partial pressure of carbon dioxide in the blood needs to be higher than outside. And it is. So the partial pressure of carbon dioxide here at the blood in the pulmonary vessels is 45 millimeters of mercury. So 45 down to 40. Again, it's going down. So we can draw that slide up. We've got 45 going to 40, and this is carbon dioxide going down. Now, important point. Have a look at the gradient of the slide. Going from 104 to 40 is pretty steep, but going from 45 to 40 isn't that steep. Yet, we exchange an equivalent amount of these gases here at the airways, at the alveoli, at what we call the respiratory membrane. How? Well, it's because carbon dioxide is around about 20 times more soluble than water. That means it's easier for carbon dioxide to mix in with this gas. So it's a lot easier for carbon dioxide to move through. So the pressure doesn't need to be as steep. Think about it like this. If somebody doesn't want to go through a doorway and you give them a push, If they really don't want to go through that doorway, you've got to give them a hard push. Oxygen doesn't really want to go through, so it needs a very hard push, right? Carbon dioxide wants to go through the door. You don't really have to push it much. It goes, it's okay, I want to get through. So you don't need much of a push to move it through. But both are still going down their own concentration gradient. Now that makes sense. So now in the bloodstream, we've got 40 millimeters of mercury of oxygen moving through and 45 of carbon dioxide. Let's first focus on the oxygen. Let's bring it down here. So we've got the partial pressure of oxygen. Now here's the thing, sorry, let me just take one step back. It's going from 104 down to 40, which means we're now going, that's going to be a higher number, right? It's 40 as it's coming in, but now we're adding gas. So what we're going to find that the partial pressure of oxygen is coming through is 104 millimeters of mercury in the blood, right? The carbon dioxide, it's losing some. So it's not going to be 45, it's going to be 40. So the partial pressure of carbon dioxide is going to be 40 millimeters of mercury. Now this is important because we want to deliver oxygen from the bloodstream to the tissues, right? That's its job. And we want to take carbon dioxide from the tissues and throw it into the blood. Again, so we can throw it back out. So again, the partial pressures, what are they? For the oxygen here, the partial pressure needs to be lower here. And it is. The partial pressure of oxygen in the tissues is around about 40 millimeters of mercury. The partial pressure of carbon dioxide in the tissues is higher because they're producing carbon dioxide and it's 45. So it's going down from here to here, perfect. And it's going down from here to here, perfect. All of this has to do with an application of Henry's law, right? Going down its own partial pressure gradient. All right, if we take a look at the fact that we've got 4 different phases here, right? First phase is bringing gases into and out of the lungs. This process of bringing things into and out of the lungs is termed ventilation. Ventilation. That's bringing gases into and out of the lungs. It's not called respiration, it's called ventilation. Then we've got the exchange of gases here at the respiratory membrane. This is called external respiration. External respiration. Then we've got gas transport happening here. And that's exactly what it's called. It's called gas transport, right? So this part is gas transport. And then we've got the exchange here from the blood to the tissues. And this is called internal respiration. Now your question might be, but both external and internal respiration are happening inside the body. Yes, but if you've got a tube that enters from the outside of the body and that tube goes all the way down, you could still say that that's the external aspect of the body. For example, following the digestive tract, inside the esophagus and the stomach and the gastrointestinal tract can actually be referred to as external, right? So this is external respiration, that's internal respiration. So what's the difference between the term ventilation and respiration? Ventilation is simply moving gas into and out of the airways. Respiration is gas exchange, exchanging gas across membranes. Very important. And how did we bring it all in? By changing the pressures. All right, the question now is, how do we get these gases out? Because we want to exhale that carbon dioxide out. Well, we apply Boyles Law. We need to do something that decreases the volume of the thoracic cavity. How do we do that? Well, remember originally we had the diaphragm contracted. We now simply relax the diaphragm, it snaps back. We relax the external intercostals, they relax back. And because the airways are filled with elastic tissue, they snap back as well, decreasing the volume. Because you decrease the volume, you increase the pressure in here, and they want to go down their pressure gradients. Now, higher pressure in here than outside, it rushes out. But what if you want to forcefully exhale? Well, that's when you start recruiting those internal intercostal muscles, and they pull the rib cage down and in, right? You can contract the abdominal muscles that will be here, and they push it up and in, right? The abdominal muscles, up and in. Again, further decreasing the volume, increasing the pressure, and gases escape. Final point I want to add, because we've spoken about a lot, is I told you that you've got a lot of elastic tissue inside of your airways, and this is important. So we've got the trachea, and let's now say it branches into the bronchi, and let's now say it branches out into all of these various bronchioles. So I want to draw this up like this. Let's highlight these tubes like that. The elastic tissue that's present hold on to the tubes, right? Like that, and attach to the lungs. Now, what this means is that while the elastic tissue, when you take a breath in, they stretch, and when you relax, they snap back, perfect, they hold on to the airways and they keep the airways open. That's important. The elastic tissue keeps the airways open. When you smoke cigarettes, the cigarettes tend to destroy this elastic tissue, right? Now, what do you think that means? It's two things. One, you'll take a breath in and the airways and the lungs get larger, but it won't snap back as well. So in emphysema, which is a disease state generally caused by cigarette smoking, where these elastic tissue is destroyed, in emphysema, the lungs expand, but they don't snap back because the elastic tissue isn't there, right? So they remain hyperinflated. And so they can't get rid of that carbon dioxide because they can't decrease the volume. So what do you think they do? They recruit all those accessory muscles, the abdominal muscles, they recruit the internal intercostal muscles, and they try to forcefully exhale out. But the problem with forcefully exhaling is that the elastic tissue, which is now gone, can't keep the airways open, and the airways will collapse. And so in emphysema, it's very common for their airways to collapse. So what they need to do is they take a breath in, which isn't too bad, right? Because it's easy to open the lungs up, but they don't snap back, so they stay hyperinflated, so they try and force it out, but they don't want their airways to collapse, so they purse their lips and try and control the forceful breath out, so it's not one big forceful breath and everything collapses. So they go, and you'll see that they purse their lips. The term that's sometimes used and historically used was pink puffers, which is a horrible term, but they're pink because they're exhausted. They're using a lot of energy to breathe because it's difficult, and they're puffing because they're trying not to collapse their airways. So there's a clinical application of understanding this. So that was a whirlwind tour of an overview of respiratory mechanics and respiratory physiology. I'm Dr. Mike. Hi everyone, Dr. Mike here. If you enjoyed this video, please hit like and subscribe. We've got hundreds of others just like this. If you want to contact us, please do so on social media. We are on Instagram, Twitter and TikTok at Dr. Mike Todorovic, at DrMikeTodorovic. Speak to you soon.